Picture a heart attack. What do you see? If you're like me, it's probably something like Vito Corleone. And we're definitely not alone here. Researchers actually analyzed the most popular films on IMDb that contained heart attacks and found they, quote, predominantly portrayed more severe symptoms, such as falls and loss of consciousness, and a higher rate of more unusual presentations, such as screaming. Additionally, the race and gender breakdown looked like this. Now, it might feel silly to nitpick over representation in Hollywood heart attacks, but there are real-world consequences to consider. Hollywood is one small piece of a much deeper problem plaguing women's health, and while there are the obvious sociological factors at play, the full story is far more interesting and far more tragic than you might think. Ask a woman what health condition worries her most. Chances are she'll say breast cancer. But heart disease kills 10 times as many women.
You know, a woman can go about having no symptoms, the busy superstar, mom, daughter, just running the household, nucleus of the family, and then all of a sudden have a bad heart attack. The statistics are actually hard to imagine, but 1 in 3 women will die from heart disease.
Despite heart disease being a leading cause of death for women, a 2019 survey found that just 44% of them identified it as such, with lower awareness among non-white women and women with hypertension, despite being higher risk groups.
So the traditional concept we have of heart attacks being the crushing chest pain, hand on your chest, sweating, vomiting, and presenting to the emergency department and being found to have a heart attack is seen more commonly in men. However, part of the issue is that women also experience these but tend to ignore them more. So yes, they have the symptoms, but they just tolerate them better or dismiss them as being a heart attack because many women don't feel that they're, predisposed to a heart attack. Their chest pains or their symptoms from the heart attack, not only do they tolerate it more than men, but also they dismiss it as being a heart attack. Sure, why would I be having a heart attack? I'm a woman and I shouldn't.
Sure.
I don't have heart disease.
As mentioned before, Hollywood might play a role in women dismissing or tolerating more severe symptoms of a heart attack, since those tend to be associated with men. But the more common symptoms among women are even worse, not because they're more intense, but because they're incredibly vague. Shortness of breath, nausea, back or jaw pain, dizziness, fatigue, all things easily attributed to stress, anxiety, a common illness, or for many women in midlife, the hormonal changes of perimenopause and menopause. As a result, heart disease isn't always the first thing patients or even providers consider.
So a lot of their symptoms are very difficult to assess and sometimes difficult to categorize as coronary artery disease related symptoms. This becomes a major issue in the emergency room because sometimes there's delay of treatment. And unfortunately, delay of treatment may mean more complications, more morbidities, and more mortality when it comes to heart disease complications of women.
And that's actually if you're lucky enough to get warning signs. Because 64% of women who die suddenly of coronary heart disease had no previous symptoms at all. So today, we find ourselves in a place where we portray heart attacks as a primarily male issue, misinterpret women's symptoms, and disproportionately focus on issues like breast cancer. And to fully understand how we got here, we actually have to go back to one of the biggest medical disasters in history. In the spring of 1956, an employee at a West German pharmaceutical company brought home a newly developed drug to help his pregnant wife with sleep and morning sickness. The medication wasn't approved for sale yet, but researchers at the company were more than confident in its safety. In fact, during animal testing, they found it virtually impossible to administer a lethal dose. And in a time when sedative addiction and overdoses were a public health crisis, this was a major breakthrough. But at the end of the year, on Christmas Day, the woman gave birth, and the family was devastated to see a baby girl completely missing her external ears. Neither the family nor doctors made a connection to the pills. At the time, it was generally accepted knowledge that the placenta was this impermeable barrier that protected the fetus from harmful substances in the mother's blood. So 10 months later, the medication, thalidomide, started to hit shelves under a variety of names, aggressively marketed as the leading morning sickness therapeutic for pregnant women. A few years later, in September 1960, the drug arrived at the doorstep of the FDA under the brand name Kevadon, and its review was assigned to a woman named Dr. Frances Kelsey. Despite being on the job for less than a month, Kelsey wasn't convinced by the company's claims that the drug was safe. In response, the manufacturer flooded her office with visits and phone calls, insulted her, and complained to her supervisors. Still, Kelsey continued to stall the medication's approval in the American market long enough for the truth to come out. And the truth was horrific. Over 10,000 reported instances of babies born with missing limbs, fused bones, blindness, deafness, facial paralysis, not to mention the 40% of them that were miscarriages or stillbirths. It was a tragedy that shook the world and forced a response from regulatory agencies across the globe to completely ban the use of thalidomide in pregnant women. Kelsey was rightfully celebrated for her actions that prevented untold death and suffering. But the thalidomide tragedy cast a long shadow, the coldness of which we still feel today. In the mid-20th century, male bodies were generally seen as the default in a medical sense, from which women were but a negligible deviation. So even if you set aside the obvious sociological factors of that time, it's no surprise that women were underrepresented in clinical trials. And after the thalidomide tragedy, things got even worse. In 1977, the FDA issued new guidelines instructing early phase clinical trials to exclude, quote, women of childbearing potential, which include women on contraceptives, women whose husbands use contraceptives or are vasectomized, single women, women in mental institutions, and it would be over 15 years before any of this was undone. So we discussed how heart disease symptoms can differ between men and women, men skewing toward the intense crushing chest pain, women having more ambiguous symptoms. But what does this all look like in a scan? Turns out both male and female angiograms are pretty consistent with the symptoms each describes. This is another instance in which the male default rears its ugly head. By using male-centric angiogram images as an example of what to look for to diagnose heart disease, women are left behind. Not only are the problems harder to detect on an angiogram, but the treatment options are more limited as well.
We are not small men. And unfortunately, in the medical field, that is how we've been treated. I like to call estrogen our superpower, and we're learning a lot more about this and understanding the valuable role that estrogen plays as a protective hormone for women. Estrogen helps to keep a woman's blood vessels soft and pliable. Plaque doesn't stick to it as easily when estrogen's around. So for us women during our menstrual years, our risk of cardiovascular disease is significantly lower than our male counterparts at our same age. Once a woman then hits menopause and estrogen goes away, then our cardiovascular risk starts to climb. And what this looks like for a lot of women is they go for their annual exam and do their regular cholesterol blood work, for example, and all of a sudden, the cholesterol numbers are significantly higher than what they were the year before, but a woman hasn't changed the way she eats. She hasn't changed the way that she exercises, and all of a sudden she's seeing a significant amount of metabolic changes going on in her body.
Got it.
So it's very disheartening for a woman to see this until we take the time to educate and let a woman know and understand metabolically the significant amount of changes that are going on, from insulin resistance changing, right? Inflammation markers changing in a woman's body, cardiovascular risk, blood pressure rises, lipids start to elevate, all because menopause and estrogen went away. But this also speaks to us as clinicians. And so if we're not paying attention to this, we're not able to get ahead of this with our patient, educate them about the changes that are needed during this phase, screen them appropriately, right? By getting early cholesterol, taking a look at advanced cholesterol markers, as well as getting heart scans, so that we can better educate a patient. Because for females, the way that we express or the symptoms that we have when we are having a heart attack is very different than a man's.
Right.
And now it's a challenge in AI development, as engineers have to carefully train models with the special consideration that a lot of the data skews heavily toward males. Because heart disease is so often a silent killer, the ability to detect it before symptoms appear is absolutely critical.
Even women who have completely normal labs can still be developing plaque slowly over time, which accumulates asymptomatically, again, no symptoms, into a bad problem. It's taking a holistic view, getting a strong family history, combining it with labs, and then adding in any additional tests, maybe cardiology-based tests, or even tests that we can do at our imaging centers, which can help complete the picture and give a real snapshot, not just evaluate the risk as a snapshot, but really give a strong visual of what's actually happening to the woman's arteries.
The most promising fact is heart disease and deaths from it are extremely preventable. In addition to the obvious healthy diet and regular exercise, modern imaging is more advanced than ever. A CCTA can render highly detailed 3D images of your coronary arteries, and some imaging providers even offer advanced AI analyses that take this even further, evaluating the quality of the plaque and identifying types of plaque that may be missed using traditional screening alone.
Given that heart disease is the #1 killer, why are we not required by insurance to get a CCTA? I don't understand. You need to kind of know if there's current damage happening, and that's, you've got to see that soft plaque, which you can't see in the regular scan.
And although we've convinced women for decades that mammograms are their most critical preventative screening, turns out there's a silver lining.
On a mammogram, we have the ability to detect what's called breast arterial calcifications. And the latest data shows that depending on how much breast arterial calcifications you have and how it changes over time, we can tell whether your risk for developing heart disease is high or low. And so that's why the mammogram is now elevating itself into a multi-benefit test, right? Because now you can talk about breast cancer as well as heart disease.
Today's medical world is still playing catch up for women's health after so many years lost. Even in recent or ongoing health trends like ice baths, which were initially hailed as wonderful, only for us to later learn it's unclear if women experience the same benefits. Or the myths around high-protein diets and weight training, making women fear that they'll get overly buff and lose their feminine look.
For us as women, we're very intuitive, right? Especially when it comes to other people. And that is because of the superpower that estrogen gives us and how it makes our brain want to care and protect, okay? But the problem with that is that we don't do it very well for ourselves, right? Us as women, we always come last in line when it comes to the order of who needs what. And so taking us back, we need to be the best barometer for ourselves. The problem too, Alex, with our typical healthcare system here is that it's a sick care system. And it's there and it does a very good job when you're sick, right, of fixing with either medication or with surgery, right? But what about keeping your body healthy so that you never have to get that sick that you need medication or surgery? And the whole goal of Cascade is to get upstream to help health seekers understand, number one, where their risks are, how we can navigate through those risks without crashing the car, paying attention to these check engine lights that come on as we're looking deeper than just scratching the surface with basic assessment.
The most important thing is to stay proactive. Don't ignore symptoms even if they're vague.
Inspector, somehow all of this has a familiar smell.
Trust your instincts, listen to your body, or at the very least, get some peace of mind.